Joining us now, obesity medicine specialist and founder of True You Weight Loss, Dr. Christopher McGowan. Dr. McGowan, welcome back. So this announcement making a lot of headlines from Weight Watchers. This coming after the FDA issued a reminder to sellers that medication must address drug shortages to meet the exemption of an FDA approval. With that said, how safe are these compounded weight loss drugs if they aren't approved by the FDA?
Yeah, Hena, thanks for having me, and a lot to talk about here. So yeah, Weight Watchers is just the latest company to jump onto this compounded medication bandwagon. And we've seen this with so many others, including Noom and Ro and Hims. And the reason is that this landscape has vastly changed. And these traditional weight loss treatment companies that focus on lifestyle really aren't as relevant. So they've had to pivot drastically. Now, as far as these compounded medications, they are not FDA regulated. They are fundamentally different than brand name Zepbound and Wegovy. So patients really need to understand that, and they need to exercise caution because there are risks of taking them.
What are the risks? Are they safe here, Doc?
Well, we don't really know because they aren't FDA regulated. And this is the Wild West when it comes to compounded medications. Now, while there may be safe formulations available, it's hard to know what you're actually receiving, what you're injecting from a safety standpoint, but also from an efficacy standpoint. So we do hear from so many patients who have tried these medications, not necessarily from Weight Watchers, but these compounded versions, and they haven't lost weight. Maybe they've just experienced side effects. So you need to be aware they are not equivalent to the brand name.
Now, we know the FDA removed tirzepatide injections like Mounjaro and Zepbound from its drug shortage list. I have friends that have actually been affected by it. Though the FDA is reconsidering Eli Lilly's removal, could patients lose access to some of these compounded weight loss drugs right now?
Yes, so here's what's happened. The tirzepatide or Zepbound is now considered in supply. It's not on the shortage list. What that means is that compounding pharmacies can no longer exercise this loophole of sorts that has allowed them to fill that gap during the shortage. So what we know is that supply will be cut off. And so patients who are currently taking a compounded version of tirzepatide will run out of drug in the very near future. They'll need to look for other options because we know that their appetite will return, weight will return, so they'll need to pivot to other options. And those could include other medications. If they're keen on using a medicine, there are still older medicines like phentermine and similar, or pivoting towards a procedure. You know, someone who does not want to take a lifelong medication may seek a weight loss procedure instead.
And Doc, you know this better than I do. Several companies are promoting these compounded weight loss medications, Ro, Noom, Hers, now Weight Watchers. Should our reviewers use this medication? What should they be looking out for?
Yeah, I don't personally recommend the use of these compounded medications for my patients just because of all of those unknowns and the fact that they're not directly FDA regulated. But there's another concern here, which is what is the longevity of this treatment path? So we now know that tirzepatide is not going to be available in a compounded version. Semaglutide still is, but not forever. So for someone who is going to start one of these medicines, what's the long-term plan? Because these are not short-term treatments.
And we know these medications are very, very expensive. If you can't get insurance to cover a weight loss drug, are there options like metformin? Is that a good alternative?
There are other options. Now, metformin is probably not one that I would recommend. Metformin is a diabetes treatment. It's very effective. It does help somewhat with weight, but the weight loss is quite modest. And in reality, you're more likely to experience significant diarrhea rather than significant weight loss. So it's really not a first-line treatment for weight.
People on these weight loss drugs are usually eating less. That's probably why they're taking it. But there's a new study. It found that eating less food, this makes sense, can actually help you live longer. I want to ask what you think of those findings, doctor.
Yeah, this is really interesting. Now, these studies have been conducted primarily in animals. That's an important point. And we're talking about mice. And if you feed mice less, they actually live longer. So this is really interesting. But what does that mean for us non-rodents? You know, can we translate these study findings to humans? These studies have never been conducted in humans and probably never will be because it's a really cumbersome type of study. But also we need to understand that humans are different than mice. We live 75 to 80 years, not 3. And we're also not fed pellets through a cage. So it's a different situation. But, you know, let's say that this is true. What do we do with this information? You know, I don't know that we need more reasons as to why we need to eat less. So many of us are already trying to eat less. We are literally injecting ourselves with medication to eat less. So it's really not about the why, it's about the how. And that's the difficult part. Everyone knows it is difficult to eat less for 1 week, let alone for a lifetime. So I'm not sure that we should get too excited about this yet, but it is somewhat intriguing.
I know people have so many questions about this. Thanks for coming on the show and answering a lot of those questions, Dr. McGowan. We appreciate it.